that first definition is about infertility. When you call a person as infertile, so is it only after 1 year of marriage you call them as infertile, or there is any other addition to this? Even after one pregnancy, if they are not able to get a second child for a gap of 3 years, then that is also taken as infertility. Sometimes, people want more than one child. So if after getting the first child, sometimes the second child gets very inordinately delayed. So that time the mothers may again come for infertility treatment. So that is also included as part of the definition of infertility. So assisted reproductive technology art is used primarily to address this treatment, and the main thing is in vitro fertilization. That is, the ovum is fused with the spermatozoa in vitro, that is in the test tube. Vitro means test tube, vivo means in the body. So you remember that. So and then it can be done with these various ways and then transferred into the mother. So IVF involves the following steps. Ovarian stimulation is the first step. Then you have to collect the eggs. Then you have to process the sperm and fertilize, and then allow the embryo to form, and then transfer the embryo into the mother's uterine cavity. So that is what is you have to. These are the four common steps that are processed in the IVF. So pain during the oocyte retrieval is the main cause. That is why it cannot be allowed to happen. So that pain arises from the vaginal skin and ovarian capsule by aspirating needle, as well as manipulation within the ovary during the entire procedure. This is the root cause of the pain. So anesthetist has to provide adequate pain relief and a completely immobile patient. Patient should not jerk or lift their pelvis or shake their legs. So you require a totally immobile patient to eliminate the danger, not only to avoid the pain, but also eliminate the danger of the needle piercing some major vessels inside, close to the ovary, and cause a damage. So the steps again, it can be classified as oocyte retrieval. Testicular biopsy is one of the steps to find out whether male sperms are, that is what is called sperm processing. You first check the male, find out the status of the sperm, and if there is any problem with that, attend to that. Then you fuse that, then transfer the embryo. And finally, your role does not end with just helping the formation of the fertilized ovum. You have to follow up, and majority of these patients who undergo IVF therapy, they deliver either by cesarean section, or they may also have twin or triplet pregnancy also. So your role extends up to the delivery of the mother. Ideal features include the you must be able to provide a safe, effective, adequate analgesia, and it should be rapid onset and recovery with minimum side effects or no side effects on the oocytes. It should not affect the ovary. And quick recovery time from anesthesia so that the patients can go home easily. And in large centers where a lot of patients are scheduled for oocyte retrieval, there may be 15, 20 mothers waiting or ladies waiting for oocyte retrieval. So if there is a delayed recovery, the whole procedure will get delayed. So you must have a technique by which you can quickly induce and at the same time recover the patients as quickly as possible. And it should not cause any change in the follicular fluid and pH, which will affect the fertilization. And embryo development also should not be affected. No teratogenicity should happen by the techniques that we use. Now coming to the anesthetic implication, there are drug interactions. So it is called controlled ovarian stimulation done by three defined protocols. So what they do is gonadotropin releasing hormones agonist long protocol. This is one technique. Gonadotropin releasing antagonist protocol and minimum stimulation or minimal stimulation protocol. So when you use this hormone for a longer duration, and then agonist protocol offers a shorter duration, along with the risk of ovarian hyperstimulation syndrome. This is one of the major side effects of using this hormone. And this ovarian hyperstimulation syndrome is sometimes asked as a short note question in your theory paper, and you have to classify it into mild, moderate, and severe. The main effects are due to the excessive levels of estrogen causing fluid retention, abdominal swelling, whole body swelling. All these things can happen, and mother can have severe pain and all those things because of OHSS. And in the minimal stimulation protocol, it also includes administration of a drug called clomiphene citrate and gonadotropins, and it has a lower cost and used in patients who have very poor oocyte levels. And hormonal manipulations result in excess estrogen levels varying from zero at the baseline to supraphysiological concentration at the time of oocyte pickup in the patients. And so the albumin and alpha-1 acid glycoprotein synthesis are affected by the estrogen, and which reduces the drug binding and leads to an increase in free fraction of highly protein-bound drugs in the circulation. So this is the effect of that high levels of estrogen in the body. The second factor you have to remember is the coexisting illness, which you described. They may have most commonly thyroid disorders, especially hypothyroidism may be present in majority of the patients coming for infertility, and they may be put on thyroid supplements. And the third thing is pregnancy is a hypercoagulable state, so it can be further aggravated by the use of the hormone injection that we put them on. So majority of them are prescribed with anticoagulants to prevent deep vein thrombosis and thrombus formation. So they may be on heparin or aspirin, and if they have been put on these things, you should ask the history whether they are taking any aspirin and stop them at least 3 days before the procedure that is being done. Fourth point is advanced maternal age. Many of them, when they come for infertility treatment, they have got married, waited for sufficient number of years for natural pregnancy to occur, and then when it doesn't happen after 10 to 12 years of married life, then only they come. So majority of the mothers are past 35, and so this advanced maternal age is a problem, and many of them may have some depression also because the taboo that they face in the society. So they may be on some antidepressant drugs also. So you must ask about history of intake of aspirin or heparin, and the second history, drug intake history, is whether they have been taking any selective serotonin or antidepressant tablets. And if they are taking those tablets, that may interfere with the cytochrome P250 inhibition. So it may cause pharmacological effects on that. Then there may be serotonin syndrome sometimes, and it may potentiate the anticoagulants because of the enzymatic inhibition. And adjustment of the dosage, especially opioids, is very much required if they are on these antidepressant agents. And fifth point is many older women coming for assisted reproductive therapy, they have predicting successful IVF outcomes, number of oocyte decreases with advancing age. So as the mother becomes older or the woman becomes older, the production of oocytes is reduced. So that is another reason for the failure of conception. And also miscarriages are more common if the mother is very aged. And for the anesthesiologist, they may have more common comorbidities like hypertension, diabetes, all these things may be present in them than in the younger age group patient. And fertility preservation sometimes is done for patients who have had malignancy, who have got it treated either by chemotherapy or radiotherapy, and then they may come for fertility treatment. So these treatments, that is chemotherapy and radiotherapy, may reduce the response to ovulation induction, and there is a risk of organ dysfunction which might complicate the anesthetic management. Lastly, a large number of women reporting for ART are obese. Majority one of the causes of this is the PCO and obesity, and these patients have all the complications of obesity like a difficult airway, hypertension, diabetes, restricted mobility, joint problems. Putting lithotomy may be very difficult with these. So they may also have associated liver, renal, cardiac, or pulmonary pathology along with difficulty early. And for the surgeon, visualization of the ovaries becomes difficult due to high fat content inside the abdomen, and this may lead to longer duration of procedure. So when you have scheduled about 15 cases, if you get two obese patients, that itself may take about 45 minutes to 1 hour, delaying the list completion. So that means there is another disadvantage. Now coming to the anesthetic techniques for oocyte retrieval, transvaginal oocyte retrieval is performed as a daycare procedure because of short duration, and it is done as a NORA. Mostly they don't take it to the major OTs for doing that. It may be a side OT in or an adjacent room close to the major OT. And different methods of anesthesia, then everything is listed right from general anesthesia to acupuncture and TENS. But this last one, acupuncture and TENS, is not commonly practiced because the physician, especially in a busy center, may not have time to wait for the technique to take effect and do the procedure. And commonly used drugs are these drugs like induction agent, propofol, tipentone, ketamine, etomidate. These are the 4 drugs, and you must be able to describe what are all the properties and their effects on the oocyte retrieval. Then opioids given for analgesia, benzodiazepines given for anxiolysis, and inhalation agents and nitrous oxide. All the common drugs which we use, you can classify them like that and then write about the properties and their effect on the oocyte. Now, obstetric complications that can happen because of this therapy are hormonal stimulation may lead to and can lead to the following: increased coagulation and decreased fibrinogen. Ovarian hyperstimulation syndrome is an iatrogenic complication of ovarian stimulation, and multiple gestations or pregnancies are very common by this treatment, and sometimes ectopic pregnancy. The oocyte, I mean the fertilized ovum may get stuck in the fallopian tube, or it may be deposited outside somewhere when you transfer the embryo. So these things may lead to ectopic pregnancy, and the baby may be of low birth weight or preterm or small for gestational age. So for male infertility patients requiring testicular biopsy, you can do it under local anesthesia. You can just infiltrate the skin and then the testicular tunica vagina albuginea, and then make an incision and take a small bit of tissue, and it can be done as an outpatient procedure. But for varicocele excision of the spermatic cord, you may require a spinal or an epidural, or if you are good in hernia block, you can do it under hernia block also, but that is also done as a daycare procedure. Okay? So I think these are the points that you can mention in your answer.